General pathology. Okay. Uh, so first, the topic is about general pathology. In general pathology, the term general means we are looking about general reaction of cell or tissue, general reaction of cell or tissue towards any stimuli, towards any stimulus. So in case of general pathology, suppose this is the cell, this is the cell, how it reacts, how it reacts. This is the stimuli. These are multiple stimuli. When stimuli act on a cell, how it reacts, that comes under general pathology. That comes under your general pathology. If the same things it is applied to the systems of the body like nervous system, reproductive system, digestive system, then it is called systemic pathology. Systemic pathology. If all these reactions suppose this is the cell and this stimulus is a special stimulus, suppose it is bacteria or it is virus. It is virus. Then how the cell will react? That comes in your spatial pathology. So in spatial pathology, we study about the specific agent which may be bacteria, virus, or your parasite, trematode, cystode, and fungus. So these agent, how they react, that comes under spatial pathology. For example, there is rabies virus. Rabies virus, when it comes inside the cell, it may lead to formation of negri bodies. Negri bodies. So, how a rabies virus enter inside a cell and how the cell will respond, that comes in your spatial pathology. So, first we'll see about general pathology. In general patho, we'll take one stimulus, any stimulus, and apply to the cell. This is the cell. This is the cell. How the cell will react, whether the cell will adapt or it will die, that comes under general pathology. So if we start the story of general pathology, here is a healthy, normal cell. This cell is maintaining its homeostasis. It is maintaining its homeostasis. If some stimuli comes, if some stimuli comes to this cell, suppose this stimuli is a simple stress. Then how the cell will react? That may be adaptation. Cell will adapt. If this stimuli is so heavy that it is unable to adapt, then there will be cell injury occur. This cell injury may be reversible or it is irreversible. Reversible means if you remove the stimuli, cell will return to the normal function. That is reversible. Irreversible will you are sure that the cell will die. Cell death will occur. So in today's lecture, we'll study if there is stress or mild or non-injurious stimuli occur, the cell will undergo adaptation. What are those adaptations? How a cell adapts? What happens if it will not be able to adapt? How the cell will go into cell injury? So in this, we'll cover this part up to the adaptation. So in general pathology, there is stimulus and the cell is responding. So two things are there, stimuli and response. This is the response by the cell. If the stimuli is a stress, then response will be adaptation. Response will be adaptation. How the cell adapt? That may be atrophy, hypertrophy, hypertrophy, hyperplasia, and metaplasia. If this stimuli is injurious stimuli, if it is injurious stimuli, that may lead to cell injury. That may lead to cell injury. Cell injury may be reversible or irreversible. Third is the stimulus may be chronic injurious. That is chronic stimulus. The response will be accumulation. Accumulation of fat, carbohydrate, protein inside the cell, or accumulation of some pigment like melanin, or accumulation of calcium. Number 4, if this stimulus is sublethal, then the response of the cell will be cellular aging. Cellular aging. So these are the 4 stimuli and these are the 4 response. So in general pathology, we see the how a cell react to the stimulus. So first stimulus is a stress and the response is adaptation. So first topic will be cellular adaptation. Cellular adaptation. These cellular adaptation may be adaptation in size of the cell or shape of the cell and function of the cell. These are the adaptation. So stimuli is stress, that is non-injurious one, and this is the cell, and it will lead to hypertrophy, hyperplasia, or metaplasia. These are the cellular adaptation. The important MCQ for cellular adaptation is this is purely reversible. Reversible. This is reversible. If you remove stimuli, if you remove the stimuli, it will reverse back to the normal size or shape. So, first adaptation, number one is hypertrophy. Hypertrophy. Hypertrophy means increase in size. Hypertrophy is increase in size, but number remain same. This is the cell. It increases in size, but number remains same. What is the mechanism of hypertrophy? Mechanism of hypertrophy. How the cell increases its size. So the mechanism is due to increase in protein synthesis. This is the main mechanism. Due to increase in protein synthesis, the cell become large in size. For example, skeletal muscles. Skeletal muscles. In case of gym, those who are regular doing their gym, their muscles become like this. This is known as hypertrophy. Hypertrophy of the skeletal muscle. This hypertrophy is due to this increased protein synthesis. So after continuous gym or weightlifting, muscles become hypertrophied, and the mechanism is increased protein synthesis. So this hypertrophy may be physiological or pathological. Hypertrophy, where cell becomes big, that may be your physiological or pathological or pathological. The example of pathological is dilated cardiomyopathy. Heart becomes dilated. That is an example of pathological hypertrophy. Physiological is the exercise. For example, race horses which are under training, their muscles get physiologically hypertrophied. Pathological, dilated cardiomyopathy, where heart muscles becomes dilated, hypertrophied. So, important point about hypertrophy is only 2 points are important. Size increases, number remain same, and mechanism is increase of protein synthesis. These are two important. Next is hyperplasia. Hyperplasia. Hyperplasia means increase in number, but size remain same. Size remain same. Question is why number of cell increases? What is the mechanism of hyperplasia? The mechanism is increase in growth factors. This is increase in growth factor due to demand of cells. Due to demand of cells. For example, this is a cell and it needs growth factor. The growth factor comes and this growth factor will stimulate transcription factor inside the nucleus that may lead to cell proliferation. That may lead to cell proliferation. So this happens in case of pregnant uterus. Physiologically, uterus is pregnant and how to increase the number of cell of the uterus? Growth factor comes that stimulate transcription factor and cell proliferation. So the mechanism why the number increases because of growth factor. Why growth factor? There is demand of the proliferation. In case of pregnancy, there is demand for the proliferation. One more example, liver regeneration. Suppose this is a liver and if piece of this part, it will regenerate. It will regenerate. By which mechanism? By hyper. Yeah. So there is limited regeneration power. There is limited regeneration power in liver, and that is because of hyperplasia. This remaining portion will be regenerate. So this is hyperplasia, where number of cells increases. Is metaplasia. Metaplasia means one adult cell replaced by other adult cell. Mature cell replaced by another mature cell. But the condition is, the important point is of same germ line. Germ line means either ectoderm or mesoderm or endoderm. The conversion of one cell, it should be within the same. Example, columnar becomes squamous. Columnar becomes squamous. Germline is same, that is here also ectoderm. Happens in case of chronic mastitis. Chronic mastitis. Columnar because udder is a gland, so columnar becomes squamous. So one cell convert into another, but within the same germline. Similarly, one more example. One more example. Myositis ossificans means in the muscle bone is formed, have same germline, that is mesoderm. It is also belong to meso. So conversion of muscles into bone. So one mature tissue, one mature cell convert into another mature cell within the same germline. There is more example for metaplasia that is very important, and that is Barrett's esophagus, dog. Barrett's esophagus in dog. This occur in case of GERD. GERD esophagus, and this is the stomach. Acid is there in the stomach, HCl. This is esophageal reflux. This acid reflux esophagus. At this point, there is epithelium in the esophagus. But due to this acid, there is metaplasia. There is occurrence of metaplasia. So what happens in esophagus in case of GERD disease? This is the acid. This acid touches here. It touches the esophagus lower part. At this part, squamous epithelium is there. Squamous into cuboidal epithelium. It convert into not cuboidal, columnar epithelium. And these cells contain mucin. So these cells are called goblet cell. Goblet cell. So the lower develop columnar epithelium or goblet. So Barrett is there is columnar meta. There is columnar meta. The squamous cell of the lower esophageal part continuous acid irritation. They change into the columnar. So the germline is same. It is also of ectoderm origin, also of ectoderm origin. This esophagus, Barrett esophagus means why columnar metaplasia because of the reflux of acid from stomach to esophagus. So of this acid continuous irritation, squamous columnar. So this next is atrophy. Atrophy means decrease in size, decrease in number. Both are decreases. What is the mechanism of atrophy? The mechanism is decrease in protein synthesis and protein degradation. This is by process autophagy. Less synthesis, more degradation. The size of this layer, uh, this is muscle. This is the muscles. It will become like this. The size of the cell decreases. Size decreases because protein synthesis decreases and protein degradation increases. Next is dysplasia. Next is dysplasia. Dysplasia, disorder, dis or disarrangement of the cells. The cells. This disorder or disarrangement form of size or nucleus. Nucleus size may be increases or mitotic figure increases. It means suppose there is one tissue, some cells are small, are large, some have different shape. So shape is different, size is different, have big nucleus, some have multiple chromatotic figures. So this is known as dysplasia. And size, shape, nucleus, everything is disordered. And this the MCQ for dysplasia is it is a dysplasia is a stage initial stage of cancer neoplasm. It is a precursor stage of neoplasm. So if this is a cell, and in this cell, if we give stress, then the cell may increase in size increase, or cell may increase in number, or cell may change its shape, that is metaplasia, or may become disorder, dysplasia, or cell may become small in size, atrophy. If you give stress as a stimulus, then the cell will respond, it will react in decreasing size. Mechanism is by increasing proteins, or it may increase number, decrease in size and number. It may change to metaplasia or dysplasia. This is how a cell reacts. This is known as general pathology, where how a cell reacts to mild like stress. Then one term, atrophy is not equal to age, aplasia and hypoplasia. Atrophy is not equal to these terms. Atrophy, this is the cell, it will attain its full size, it will reduce. This is in case of hypoplasia, this cell will never attain size. In agenesis, in all these cases, it will never attain full size. But in case of atrophy, after becoming full size, it will reduce. But in case of agenesis, aplasia, hypoplasia, it will never attain full size. This is the difference. So, if you give stress to your cell will adapt. If it is unable to adapt, then it will undergo cell. Then it will undergo cell. So this will cover in next topic.